good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. I'm here at the Drug Policy Summit Malaysia, where activists and policymakers and law enforcers are debating how to move beyond the war on drugs. Portugal's experience in decriminalising drugs some 25 years ago offers a real-world case study. Can compassion and public health succeed where criminalisation has failed? Joining me on the show to discuss this further, I have Superintendent Filipe Lourenço Costa, and who is with the Lisbon Metropolitan Command of Portugal's Public Security Police. I also have Dr Nuno Capaz, who is a sociologist with the Lisbon Dissuasion Commission. We'll find out more about the Portugal experience. Welcome to the show, gentlemen. Thank you so much for being here with me. So, Portugal, always cited as a model for drug decriminalisation. I want to understand what it was like some 24, 25 years ago when the decision was made to move away from the criminal punishment of, for people who use drugs. Talk to me a little bit about what motivated Portugal to move away from the war on drugs. Nuno, if I may begin with you.
Okay. So what we had throughout the 80s and 90s in Portugal was what was considered an epidemic usage of heroin, mostly injected usage, with all the associated issues around that mean of using that particular substance, meaning a lot of overdose deaths, a lot of health issues associated with the usage, a lot of social and physical degradation also of the users. And after 25, 30 years of a prohibitive approach, we decided to try a different way and to treat drug users and the drug-related issues as an healthcare issue. And so we moved away from the criminal and judicial system and into the healthcare system. It's basically the change in the law that we did by decriminalizing was basically just downgrading the possession for usage from a criminal offense to an administrative offense. It's still forbidden. People are not allowed to carry any sort of illicit substance with them. The difference is that nowadays the possession for personal usage, because it's dealt as an administrative offense, very similar to the driving offenses, the users are basically referred to the Dissuasion Commissions, where I work, which is the administrative authority that was created to replace courts. Okay. But there's still a procedure involved, it's still illegal, the police still apprehends a substance on the street, people are not allowed to use it openly. It's basically the difference is that instead of referring the users to the criminal system and to the court system, they are referred to the health system and to the Dissuasion Commission. I think
that's a really important distinction to make, because I think a lot of people confuse decriminalisation with legalisation. We'll delve further into that. Well, delve deeper into that. I do want to find out from a law enforcement perspective, what was the situation like when 25 years ago, as Nuno mentioned, where heroin use or injected heroin was quite rampant with overdoses? How did you, what was the situation like in Portugal at the time before decriminalisation, and how did the law enforcement community adapt to the decriminalisation?
It took time, too many years, I think, but in the beginning, police officers were a little bit afraid, especially of loose information, because when we change our mindset, we change the law, then the law is a paper. Now you need to change all the mindset. And we are a lot of police officers in Portugal. You need to change those police officers. They have different cultures, different experience, different ages. So it took time. But I think in the past maybe 10, 50 years, all agree that that change was a very good change. And now we have a different approach, and all police officers do agree that we don't need. It is not possible, even possible, to punish someone that is a drug user. Okay, you see, if he is just a drug user, he needs healthy assistance, he has healthy problems, he is not a criminal. So we focus, police officers must be focused on crime, must be focused on trafficking, on drug trafficking, not on drug users. Drug users are a commission problem, are a commission mission. They just pass by us because we found them on the streets, we search them, they have small quantities of drugs, but they are not criminals, they are not an issue for us, they are an issue for my colleague Nuno, and so we are to work together every day, even if we don't talk too much.
True. I need Rui to actually start my work.
Okay, so how does law enforcement work with the Commission of Dissuasion? What is the process like?
Well, like I said before, what we deal with is administrative offense procedures. So for us to start the procedure, I need a police report from a police officer saying that someone was caught in the possession of an illicit substance. And if it's a usage situation, like I said, it's no longer considered a criminal offense. It's basically an administrative offense like the driving offenses, like the speeding tickets or the parking tickets. And so I need a police report saying that someone was caught in the possession of illicit substance. And by the end of that police report, the person is notified to be present at the Dissuasion Commission. So I need Rui to actually do my job. To start my job.
So then what happens? So if someone is caught with drugs for personal use in Portugal, what happens next? Talk me through the process side.
At the Dissuasion Commission.
Yeah.
Okay. Basically what we do is risk assessment. We have a technical supporting team, psychologists, social workers that work with us, and they do a preliminary interview. Normally takes around 45 minutes, where they will have to help us assess the risk level associated with usage. We have a scale, a 3-step scale, so we have to grade the user as a low risk, medium risk, or high risk situation. And basically, low risk situation is recreational, non-problematic users. Medium risk would be problematic users. It's not a recreational user anymore, but it's still not an addiction situation. And the high risk level situations are basically drug addicts. And according to that assessment, we then do referrals for either counseling or treatment according to the person and according to the availability on the network. We, again, decriminalizing for us, it's not the same thing as regulating. It's basically the diversion scheme that we came up to avoid sending people to court. And so the input of that diversion scheme is the police report that Rui and his colleagues make when they encounter someone in the possession of illicit substance. And the output of our diversion scheme, it's basically the healthcare network that is available in terms of prevention programs, harm reduction programs, treatment programs, counseling programs. So we have to, by doing that risk assessment, we are then able to do personalized referrals for that specific person. So there's no rule, there's no magic bullet, there's no one pill that fits everyone. We basically assess the person, and bearing in mind that person and that the specific problem of that person, we do referrals for the network.
That speaks to me that there's capacity in Portugal to be able to do all these risk assessments, because if you're sending them to courts, the judiciary may not have the capability to assess this.
Well, the dissuasion commissions were created specifically to deal with these procedures. And so when we were starting, we provided them with the resources to do this assessment. And we also did an upscale in terms of the general network, in terms of the treatment programs that were accessible, the prevention programs, the harm reduction programs. We also increased the budgeting for all those services, because we knew we were going to have a major influx in terms of people going into the network through the Dissuasion Commission system.
Okay, so Rui, you mentioned that it took about 10-15 years before you started to see real mindset change, a real culture change.
Yes.
Talk to me about that process, about how culture, how mindset was able to be changed, particularly amongst the police force who may do things a certain way.
Okay. In the early years, there was, as I told you, we were afraid of lose our information, our informants, because traffic investigations always start with informants, and can be fed by informants too during the years. But it didn't happen. We didn't lose the information for sure, when realized that we didn't have the facilities that we needed to bring consumptions to our police stations, we realized that something has to be done, and the change of law was a correct way to do what we need to do. And it takes time. It takes time because people need time to improve new procedures, to realize that something has to change. And in police corps are not different, but sometimes police corps are worst in some ways to adopt some new strategies.
Right.
Yes, all over the world. This happens.
It's the same everywhere. Yes.
And you also have to bear in mind that the dissuasion commissions were a new thing.
Yes.
So we had the police officers, we had the courts, we had the treatment facilities, and when we introduced the dissuasion commissions, it was a new thing, and it's still one of the few very original things about the Portuguese drug policy. So the police officers didn't knew in the beginning what we were supposed to do. Actually, we also didn't knew what we could actually do with the law. So it was a process that took some time, first for us to establish our role in the network, and then to explain our partners and the rest of the stakeholders in the network how useful could we be to that network also. And so naturally it takes time.
Yeah.
We were used to deal with the courts before the change of the law, before the year 2000, and then they appear somehow. Who is this guy?
With a strange name.
Yeah, strange names, strange new procedures. But in 5-6 years, everything's going well. Yes.
What evidence do we have that that Portugal's drug policy is working, has worked in the 25 years that it's been put in place?
Well, the statistical data is obvious. You cannot deny the statistical improvement that we have in all sorts of indicators. I would say that it's not just because we decriminalized. Decriminalized is one piece of the puzzle, but it's not the whole puzzle. Okay.
It was a kickoff.
It was exactly. It was a starting point, and it facilitated a lot of things from then on. But by itself, decriminalizing, the only problem it solves is the criminal record. If you downgrade something from a criminal offense to an administrative offense, you no longer apply criminal sanctions, you do not get a criminal record. That's direct consequence of decriminalization. But then everything else starts rolling easily because of that. The police can have a more pedagogic approach because they are not dealing with drug users as criminals. There's that barrier, which is an important barrier because normally it's one of the first contacts that the drug users have with this whole procedure that eventually will lead to some sort of treatment or improvement in their quality of life. So that needed to change also, and not calling it a criminal allowed us after a few years to not deal with them as criminals anymore. Yes. And so, the fear factor from the users also reduced a lot. For example, we were talking about that early. Decriminalizing does not have a direct effect in terms of the reducing of overdose deaths. But it does have an indirect one, because if there's two users on the street and one starts having an overdose, it's much easier for the other one to call a police officer or an ambulance or a fire department to help that other person, while in a criminal system, that person will probably just run away.
The fear.
Exactly.
Right,
the fear factor
will... They were afraid of go to prison.
Exactly. And so again, it's not a direct consequence of decriminalisation, but it also helps. And I think the key element or the most positive element about decriminalisation is that by no longer calling it a criminal offence or dealing with the users as criminals, everything else is easier along the way, both for police officers, both for me, and also for the drug users on the street, and also for all the other stakeholders in the network that have much more people coming in, or there's a different doorway for the services. And I think after 25 years, we were also commenting that earlier on, there's no one in Portugal that defends that we should go back to criminalizing drug usage.
Sure. Wow, that's amazing. What were public attitudes like in the beginning when it was first implemented? How did the public react to this? Must have been quite a radical drug policy.
In the beginning it was, and I think the biggest challenge we had, it's the same that I still have in these sort of settings like conferences and things like that, which is the basic misconception between decriminalizing and regulating. When people hear the word decriminalizing, people think that they are allowed to use it and to carry on the street.
Drug use,
Exactly, and it's not like that. It's exactly the same as the driving offences. You're not allowed to speed on that particular place. But, well, if you push your car, it will speed more than that, right? So with drug use, it's more or less the same. But if there's an encounter between a drug user and a police officer, the drug user is not allowed to maintain the possession of the illicit substance. The substance is apprehended from them. They get a piece of paper saying that they have to mandatory present themselves at the Dissuasion Commission, and we start an administrative offence procedure. So people are not allowed to use drugs in Portugal.
Then they pay a fee or something.
Exactly. And the penalties are exactly the same as the driving offences. Financial fine, community service, regular presentations. So there are penalties and there are sanctions that we can apply, and people are not allowed to have substance in their possession.
Did you have to do a lot of educating the public so that they understood what the Dissuasion Commission had to do?
Not really.
Not really?
No.
Not
we
really?
basically, we just decided, okay, we know that people are misunderstanding this. Right. Let's just keep on doing it, and people eventually will understand that it's not allowed to.
That's why it took too many years.
Too many years.
To see the results. They saw the results, okay.
Yeah.
Well, so Portugal's model often praised internationally as a system that works, but I'm sure it's not without its challenges. Are there challenges? Are there limitations? What would you consider the biggest challenge, the ongoing challenge of the system, Rui?
You want to go first?
But consider our experience in Portugal or here in Malaysia?
Your experience in Portugal.
Okay. I think it's time to upgrade our approach.
Okay.
So we were talking yesterday when we went to the police force here in Malaysia to a meeting with the director of narcotics. Then we must change the mindset again, because we are focused on the quantity of drugs that someone has in his possession. But we need to evaluate the intention, because and we are doing that kind of exchange of mindset change, because since 2023 we changed our law, and if someone has more than the quantity of drug for 10 days, according to the old law, if he has more than the quantity for 10 days, he will be arrested and goes to the court. But now we are changing. It will take time to evaluate the intention. For instance, if I have more than the quantity of heroin for 10 days, then it's more than 1 gram. But if it is for my consumption, if I have, for instance, 2 grams, but I have no money in both pockets, no other things that shows that I'm a drug dealer, so this guy, he won't be arrested, he goes to the commission. Okay. We also do our report, but the report goes to the commission, don't goes to the court.
Right, so context is very important in this.
The context is very important, but it's also very difficult because policemen need strict rules to work.
Okay.
We are a lot of people with different mindsets, with different experience. And for me, as a police leader, it is a challenge. That's why these new procedures will take time.
Yeah.
Not only for police, but also for the courts, because sometimes we are doing the procedures like the new law established, the law from 2023, but the court doesn't want to know.
Okay.
So they are doing the same procedures that they were doing before.
Okay.
So it will take time, but I think that the mindset change of possession to intention is absolutely essential for the future.
Definitely.
I would say that for us the biggest challenge is the availability of the network. Because like I said, our diversion scheme, the input is the police report, the output is the referrals that we do to the network.
Okay.
For example, at the Dissuasion Commission of Lisboa, we deal with around 2,500 to 3,000 procedures a year. So if I had 2,500 or 3,000 different responses in the network, I would be able to specifically refer that person to the specific program that could benefit their life in the most significant way. And that's normally a challenge because it implies budget, and also it implies the network is not only state-run, but it's also private-run and NGO-run. So there's a huge mix of different services. Some new, some old, some open, some closed. So for us, it's a constant challenge to, again, direct the person to the specific response that might benefit them.
Right, okay. So both of you are here discussing with the Malaysian policymakers, law enforcers, to think maybe there could be a different approach to drug policy. When you think about your own experience and you think about the Malaysian context, what are some of the key prerequisites, the conditions that make for Portugal's drug policy to succeed? What needs to happen in a Malaysian local context to be able to make sure that decriminalisation works effectively?
I would say political will.
Political will.
It's the only thing.
That's the only thing?
It's the only thing.
I agree.
Because again, police officers are very good at following orders. So if you give them the order, they will follow it.
Yeah.
If you create something similar to the Dissuasion Commission, if they give them a specific law to follow through, they will do that. If they fund NGOs to open more programs, they will open it also. If they fund or if they co-fund the private sector like we do in Portugal, they will also improve. And if they have a state-run healthcare service that basically provides all the basic needs to the population, it's easily doable. All you need is basically political will. Because like I said in the beginning, decriminalizing is not the same thing as regulating, right? So it's still illegal, and there are still mechanisms for the state to show that it's still illegal. It's not allowed to do it. There's no increase in usage because of that, because there's no increase in the accessibility of the substances. The only difference is the way you deal with the person after the person is caught. So it's again, it's not that much of a big change. If you provide the players that you have, police officers, Dissuasion Commission, treatment centers, if you provide them with the resources to do their work, they will do it.
Yeah. Really, you agree?
I agree.
You agree. So it really is about will, political will from the top to make it happen.
Yes, because you need to improve a new network. And you need political will. It's first of all, it's the kickoff.
The kickoff. And then everything else follows after.
Naturally. And if the political will is based on the assumption, like we did, that we should deal with it as an healthcare issue, everything else would follow through easily. It's just that. If you assume that as the starting point, with political will, the changes will happen.
The baseline is that.
Exactly. And then you cannot expect the world to turn into a paradise after 2 weeks.
Yes.
Okay? You need to give it time for the network to adapt, for the police officers to adapt in the first place, for the dissuasion commissions to learn their role in the network, for the network to learn the dissuasion commission role. So you need to give it time and you need to improve. You need to do a lot of formation to all the players. But basically, in the beginning, all you need is assume that you want to deal with it as an healthcare issue, and then have political will to change it.
Yeah. The Dissuasion Commission is such an innovative idea. Has it been implemented in other
Not
countries?
really.
Not really?
Not really.
So only in Portugal has it managed
a specific administrative authority to deal with the procedures of people that are caught in the possession of illicit substance for personal usage.
Yeah. Which is why what makes Portugal such a brilliant case study.
I would not.
Brilliant.
No, brilliant.
I don't want to say that because it's my job, but I would say that yes, it's one of the original things, and I think it's one of the key factors because it's the one that makes the transition from the police officer on the street to the healthcare service.
Yes, it was a very good idea, but I think brilliant, I wouldn't call it brilliant.
But you've proven that it could be done. And I think that the test case is what's important.
Definitely, yes.
And we also prove that it's not the end of the world if you no longer deal with it as a criminal offense.
And that's one thing I would like to add. It takes time to see results, as Nuno said, but because we need to be used to adapt with all the new concepts. But we realize that one thing, that if we change tomorrow, we need to adapt, we take time, but tomorrow nobody goes to the jail because drug consumption. So it starts tomorrow if we change today. This is very important.
Yeah. Well, thank you both, gentlemen, for being on the show and sharing some of your insights. I appreciate your time. That's all the time we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.